Hey everybody, I was going to talk for a few minutes today about non-invasive body contouring and some of the differences between Coolsculpting, which has been around for about 10 years, and the newest player on the block called Sculpsure, which is what I've decided to incorporate into our practice, and go over some of the differences in the two, what they do differently, and why I think that Sculpsure is better and why I decided to incorporate that into the practice as opposed to Coolsculpting. I think one of the big things, especially from the patient standpoint, is time. A complete treatment of Sculpsure for one area takes 25 minutes. With Coolsculpting, it takes 50 minutes to do one area. So that's about half the time that it takes to do. The other really nice thing that you can do with Sculpsure that you can't do with Coolsculpting is you could treat multiple areas in one sitting. So for example, if you wanted to do your abdomen and your love handles and that sort of thing, you could do that all in one sitting with Sculpsure, and that would only take you about 50 minutes. Whereas Coolsculpting, you're going to be limited to one area at a time that you're able to treat. So I really think that reduction in time is a nice thing. Another from the patient standpoint is that Coolsculpting, the applicator uses like a suction device that has to suck something up into it, and then it freezes that, and that's how Coolsculpting works. Whereas Sculpsure is actually just an applicator. It's about the size of your phone, and it just sits in whatever area you want to treat. You just have to put it on there. It's a little thing that kind of snaps onto a little band on the skin. You don't have to get this big suction to go on. So even small areas that might not fit into a suction applicator, you can treat with Sculpsure. And the other thing that's associated with that and that suction, some people describe it as a shark bite, as it sucks in and begins to cool. A lot of patients find that to be very uncomfortable. Sculpsure has no pain associated with it. It cycles between hot and cool cycles. Patients talk through the whole thing. It's very comfortable. The other nice thing is with Sculpsure, you can go to the gym. There's no downtime. There is associated downtime. Sometimes with Coolsculpting, you can have pain that can last for several weeks, requiring pain medication. Some patients have bruising. Some patients have significant swelling. None of these things have been reported with the Sculpsure device. The other thing is the technology that's being used with each device. Cryo or cold is what Coolsculpting has been using for a while. The caveat to that is that in order to freeze the fat, you also have to freeze the other things that are in that area. For example, nerves. And there are some reports out in the literature of patients having long-term numbness after having the Coolsculpting treatment because of the fact that their nerves got frozen along with the fat cells. Sculpsure uses a laser, and that laser selectively targets the fat cells, leaves nerves and any other tissue in that area completely alone. So that doesn't have that associated risk of long-term numbness with it. The other nice little perk that Sculpsure has is that you do, because of the laser, you do get some collagen remodeling, so you get some modest skin tightening at the same time as you get fat reduction, which Coolsculpting does not have that ability to do. So I'll be putting some more information about this on the website. We're very excited to be offering Sculpsure here in Richmond. We're one of only 2 surgical practices that have the device currently. And I think it's going to be really just a game changer and make a big difference for a lot of patients.